The McGill Centre for Studies in Aging was established 30 years ago. Research in age-associated cognitive decline is very important, partly because the population is aging, so more people are expected to have Alzheimer's disease, but also there's an interest in normal brain aging and how we can improve our performance as we get older. The diagnosis of very early Alzheimer's disease is now possible with special biomarkers. In other words, tests that are done using brain imaging or spinal fluid examination that reflect some aspects of Alzheimer's disease.
We have two imaging modalities available at the center. First one is magnetic resonance image. The second one is positron emission tomography. The magnetic resonance image conveys information about the structure of the brain. Positron emission tomography conveys information about the function of the brain. So we hope to use these imaging modalities in order to detect Alzheimer's disease pathology in the brains of individuals who have mild dementia symptoms. In the brain, there is a progressive accumulation of abnormal proteins, a progressive neurodegeneration, and we want to use medications or interventions that will arrest this progression. The timeline is from 5 to 8 years to deliver this research into tangible benefits to patients.
Nowadays, people come to memory clinics often because they're worried about having Alzheimer's later in life because of a close relative who had the disease. Very important is how old was that relative when they had the disease and died, because that will determine the level of risk for that individual. The motivation for most people is clearly prevention. And we are welcoming these volunteers because prevention, we think, is the best way to go for Alzheimer's disease. Why are you worried about your memory?
Because my both parents were diagnosed with Alzheimer's disease.
Yes. There's not too much debate from an ethical perspective to enroll people who are interested and willing and competent to do prevention studies. The issue is more individuals who want to know if they have Alzheimer's at a very early stage. What do you tell these individuals? Part of the strategy to help people who will have this very early diagnosis will be a support group. And we're fortunate to be able to work with the Alzheimer's group here in Montreal, who is setting up a special support group for these young people before age 65 who will have very early diagnosis of Alzheimer's before dementia.
Alzheimer Group is a non-for-profit organization that provides service to families and individuals affected by a dementia. McGill Centre for Studies in Aging and Alzheimer Group are pioneering a support group for the younger population affected by dementia. Did Dr. Rosa-Neto explain our new program? The mission of the group is to provide services and support to these families. We will be able to provide a safe environment, share their feelings, discuss any challenges, as well as explain how these people who have just been diagnosed can still maintain a high quality of life post-diagnosis.
One aspect of the work we do at the McGill Centre for Studies in Aging is training doctors from overseas in the field of early diagnosis, use of neuroimaging, but also clinical trials, how to test the drugs in a safe way.
I'm a neurologist in the Xuanwu Hospital in Beijing. International cooperation on the Alzheimer's disease will enable us to use the better resource and better technique to find the better ways for early diagnosis and intervention of Alzheimer's disease. So this picture is a picture After I return to China, I will still work as a bridge between Canada and China for the international cooperation.
An early diagnosis in a person's life is extremely important. It provides an explanation for why the changes are occurring. It also allows an opportunity for the family and the individual to seek the appropriate support and treatment. It also allows an opportunity for future planning, whereby it's either financial or living arrangements or wishes in the future.
The field now is at a point where we can be optimistic about the future, because we have diagnostic criteria that will allow recognition of Alzheimer's before dementia. I think we'll be lucky with some of the medications we're going to test. The bigger picture, again, is prevention for people just aging as a risk. If they control their vascular risk factors in midlife, that's enough to delay onset of symptoms for the majority of people.